There's been a recent spike in positive flu and COVID cases here in the Big Country. Texas reporter Brenna Gibbons spoke with a nurse practitioner to find out more about this.
Many people in the Big Country have been testing positive for flu and COVID recently. Family nurse practitioner Elaine Thomas says that they've seen a spike in these cases since the beginning of December.
It's been very high over the last 3 weeks, worse than before. Not as high as last year, but still very high. Almost all of them are flu A, and then there's been a lot of COVID as well.
There are a few symptoms to look out for when it comes to the flu.
With the flu, we're seeing a lot of high fevers, so it's like 101 or something like that. They get body aches, headaches, nausea, vomiting, cough, nasal congestion. Looks a lot like allergies at first, and then it just gets worse and worse and worse.
She says the COVID symptoms are pretty similar.
COVID, you're not seeing the fever as much. If it is, it's a low-grade fever. You do get some of the body aches and a headache. That one's more like an upper respiratory infection. It feels like a lot of thick sinuses, a sore throat, cough. They can overlap. They look really similar at first. I think the main difference I'm seeing is that there's a higher fever with the flu this year and not as much with COVID.
Thomas has a few pieces of advice on how to avoid catching these illnesses.
I've been seeing that people who are taking high doses of vitamin C, D, and zinc are having less symptoms and not getting it as much with the people in their family that are not taking those vitamins. The other thing is wash your hands 1,000 times, wash your hands, use hand sanitizer, cover your cough and sneeze, don't let it just go out into the world. Just try to keep your germs to yourself the best you can.
Thomas says that it's important to continue to take care of yourself so you do not get sick and spread it to others. In Abilene, I'm Brenna Gibbons, Texas News.